I'm really pleased to let you know that today, the 10th of April, we launched the Sustainable Health Review. The power of the document is frankly because of the time people like yourselves have put in to its development. We received the most amazingly comprehensive and detailed and really well thought through submissions, both in terms of the interim report but also in relation to the directions that we've landed on in the final report. I think for most it's been a long journey, but it's also been a journey that's been quite inspiring to see the level of engagement we've received from within the health system, but arguably from the many people that rely on the health system, but also the key partners. The advice we gave to Cabinet when we briefed them in the process that this has been an unbelievably strong engagement process, and that's actually what has made the Sustainable Health Review such a compelling case for change. What is significant is that the Sustainable Health Review identifies a long-term agenda. It is a blueprint which seeks to rebalance a system which I think has got a proud record in many respects in relation to acute service delivery, to also to recognise that it needs to exercise a similar excellence and a similar focus in taking a far more strongly based approach on health prevention. The strength of the report, and I am incredibly pleased, as is all of the panel, the fact that each of the 8 enduring strategies and the 30 recommendations have received the support of the government. And the Minister's announcement today and also his discussion with the health leadership team made it quite clear that this is a mandate for health in going forward. We heard loud and clear, not just from health practitioners, people providing services, but also those who rely on those services, the importance of actually a range of issues. Firstly, to have a stronger focus on health prevention. People like the comfort of knowing that there's a safe, high-quality health system available, and that certainly came through the discussions. What also came through very clearly is let's focus on the things that are the most significant for the longer-term health and well-being, for good patient care, and also for good economics in relation to some of the health challenges in WA. For a start, we have strongly taken the approach that health inequity is not an inevitability. We have made that one of the driving forces, one of the enduring directions that needs to be taken forward. The fact that people's health outcomes differ on the basis of where they live, their ethnicity, or whether they have an Indigenous background is not acceptable, and that's been made quite clear. We've also heard very clear from all health partners, people within the health system and also those who use it, about the need to focus on the issues that are the most significant for long-term health and well-being, and your message very clearly was they are obesity and also alcohol abuse. The report is excellent and incredibly encouraging that it gives the government's endorsement for a significant increase in expenditure in the health prevention space. Quite simply, I can't in a very short presentation or a message to you actually do service to the depth of the document. So I really do encourage you to read it at your leisure and have a look at how we've actually picked up the feedback we've had throughout the process. A number of issues really struck us at a panel that they were at the heart of the passion of staff within the WA health system, and that was firstly actually make us exemplars in relation to our work in climate change, actually recognise the fact that we are a major producer in relation to carbon emissions, and there are both financial reasons and longer term sustainability reasons of the system to actually be a leader in this regard. Secondly, the message came through very clearly about invest in people. Focus on the workforce, focus on what actually is needed to support the system to make the necessary changes. There were very long discussions, and there are a number of recommendations that touch on the importance of leadership, that touch on the importance of culture, and all emphasise the fact that what is now required are some quite fundamental changes in behaviour. Staff also quite reasonably said we want the confidence that we'll be given the support to develop the necessary skills and to have the opportunity to be confident that they are ready to meet the challenges of the workforce needs of the future. Quite simply, this is also an opportunity for me on behalf of the panel to say thank you. The level of support we have had from all levels of the health system. We've had support from people directly delivering services. We've had those that are pivotal to the delivery of those services. What is quite clear is that you are a system that is ready for change, and what is also quite clear is that the government and the Health Minister has given you that mandate for change. Clearly there is work underway now to progress the implementation, and certainly you will see that there's a lot of focus in the final report of the Sustainable Health Review on the processes that will be followed in implementation. All parties recognise that that is actually one of the most significant issues as a system to focus on, but also one to drive a far closer relationship with the primary healthcare sector and other community and other health partners. But quite simply, thank you. Your input, your assistance, your support has obviously been incredibly influential in the drafting of both the interim report, and on behalf of the panel I'd like to say thank you.